Welcome to the CloudCare Podcast, where we ignite impact in behavioral health and human services, one conversation at a time. Join Bob Bates, CEO of ContinuumCloud, as he explores the evolving landscape of behavioral health, uncovering the latest trends, challenges, and innovations shaping the future of care. From expert insights to real-world success stories, every episode is designed to inspire action and drive meaningful change. Powered by ContinuumCloud, the only platform built for behavioral health, we're here to help you address the workforce crisis, improve clinical outcomes, and achieve financial sustainability. Ready to make an impact? Let's dive in.
Welcome back to the CloudCare Podcast, the show where we dive into the intersection of behavioral health and technology, giving leaders the insights they need to thrive in an ever-evolving care landscape. I'm your host, Bob Bates, CEO of ContinuumCloud. Today's episode is one I'm personally excited about and want to nerd out about a little bit. So, Maggie, we're excited to have you here. We're talking about metrics that matter, and more importantly, how to measure productivity in ways that drive financial sustainability and operational excellence, and a whole lot of other things that drive this industry. I can't think of a better guest to help unpack this than Dr. Maggie Labarna. Maggie is the founder of Impact Nonprofit Consulting and the former CEO of Meridian Behavioral Healthcare. She holds a PhD in clinical and community psychology and brings decades of excellence, experience in administration, clinical work, and strategic planning and data-informed leadership. Maggie, welcome to the show.
Thanks. It's great to be here.
Can you tell us, if you don't mind, a little bit about yourself?
Oh, so let's see. Like you said, I've been doing behavioral health for 40 years or so before I retired. And gosh, a lot changed in 40 years, right? I started in the days of dot matrix printers, which can probably age me a little more than I'd like.
I think you were going to say, Bob, you probably remember that, then you would be.
I bet you do. Yeah, I bet you do.
I do.
And that was a huge change period from where we started back then. And God, in graduate school, I was there when they brought in the first PC, and the only people that were allowed to even look at it were the data wonks in the stats department. And now, if you don't have good data, value-based care, and all of the things that have come on since then, if you don't have good information, you can't really function and survive. So I think that's what I'm seeing a lot in my consulting work now, is working with startups that really have no idea what they need to do to measure impact, which is essential, right, in this contracting environment. And so at any stage of the life cycle for a nonprofit, information is now just an essential piece.
You know, I see the same thing in our business, but I don't have the relevance that you do and how to run these behavioral health clinics, et cetera. I do have one question, that kind of an icebreaker. Like, tell us something that we wouldn't know about Maggie unless we knew her personally.
So I started out in behavioral health, and that's what I did for 40 years. And then I retired, and I took a painting class. And now I am what is referred to as an emerging artist. I actually have sold probably 15, 20 paintings. Wow. And if I had my druthers and I had enough wall space in my house, that's probably what I would spend most of the day doing.
I'll show you how eclectic I am. I won't hang paintings in my house, so my wife does it when I'm not around. So I get off the hook for that, but I love them. I'm just like totally clean walls. Everything has to be perfectly symmetrical.
Oh dear. Oh, no. Symmetry is dead.
Well, thank you for sharing that. So you often talk about the difference between data and useful information. How can behavioral health organizations avoid data overload and focus on the right metrics?
So I mentioned those old dot matrix printers. When I started out, and I can still remember when our organization got its first computer things, a system of 36, and everybody was like, woohoo! And it would spit out these, 24 by 20 sheets of paper with little holes along the sides. And I can remember they would stack up in my office right about sofa height. And more often than not, what there was a coffee mug on top of it, because nobody knew what all of those reams of paper contained. Lots of data, but nobody said, well, this is what it's meant to show us. This is why this is important, why we should care about it. And so all we did was feel overloaded by it. And so I think the difference between data and information is it usable? Is it actionable? Does it tell me something important that I ought to care about? And to this day, one of the things that when people say, well, I have this data, my first question is, and why do I care about it? Because if it doesn't give me something that I need in order to do my job, improve my performance or my department, it has no purpose that I can relate to.
That's a good tie-in to your being artistic, because you're right, and I love data as well, but it's the art of cutting through that data into things that are meaningful and running an organization or a company, which you far know better than I do in behavioral health.
Yeah, I'm a data wonk. I am an information wonk. I love Excel is my friend. When I discovered pivot tables, I thought I'd died and gone to heaven. But it has to mean something.
Yeah. In your blog, you mentioned that good metrics start with a clear strategic plan rooted in missions and sustainability. For organizations that are rethinking their strategic strategy post-pandemic, or even post-Medicaid reallotment of funds in the way what's the best way to align metrics to mission-driven goals?
But the key thing for a nonprofit is its mission, right? It's the only reason for its existence is its mission. But if you're going to fulfill the mission, then the programs that you have and the infrastructure that supports them are both essential, right? And so constantly what a strategic plan and a nonprofit is struggling with and is challenged to do is to remaining relevant to its clients and to its community. And boy, did we see that during COVID, right? You could either shut your doors or do something different. And then what is our impact? Do we know that we are adding value to the lives of our clients, to the communities that we operate in? And then thirdly, obviously, are we sustainable? And I think no matter what strategic planning framework you use, and God knows there's a ton of them, the answers to those questions are central to any of those planning processes. So, we saw that again. I mentioned COVID. Well, so if you weren't able to stay open and let people in, or if you couldn't go virtual, your relevancy was out the door. So the planning process has to always ask itself, am I relevant? And the only way to really know whether you're relevant, the only way to know whether you're impactful, and the only way to be sustainable is to have information that tells you how you are doing in each of those areas. And that means you have to realign things and be willing to be flexible. I know, again, when I consult, it's not uncommon to find a program that is no longer relevant or doesn't have an impact because it's not using evidence-based practices, but is somehow near and dear to either the board or the founder or the program people. And you've got to be able to show them then why. How is it that you need to retool this or decide it's time to, put it away? And again, can't do that without good information.
Yeah. Actually, as you're talking about the board and our job is to inform them and educate them as much as they do us as well, right? They look at industry trends. But you noted that aligning board members and executive leadership is essential in narrowing down meaningful goals. What advice do you have for HR leaders and those who want to make human capital metrics more visible and strategic? How do you get that to a level where people can understand that and why it's important? And by the way, I deal with it as well. I go to like the advantage and like you think those things aren't measurable, but if you don't do those things,
right,
or have the measurements you want, you'll just have a bunch of data.
One of the first things that I realized when I became CEO, and I had been at the organization 17 years before I became its CEO, so I had been in several different leadership roles prior to that. And one of the first things I did was elevate HR to the C-suite, because you can't have good programs if you don't have good people. Yeah. So recruiting talent and making sure your talent is where it needs to be is critical, which means that your HR staff, particularly the chief human resource officer, has to be fully integrated, understand what the strategic objectives are, and be able to have input into how those resources, there's only two kinds of resources in a nonprofit. We don't manufacture stuff. We don't buy raw material. Our raw material is the talent we're able to recruit.
Yeah.
So HR metrics are organizational metrics. They're critical organizational metrics. Because all we measure is service, and we have to have enough staff, and the service has to be impactful, so we have to have the right staff.
That's awesome. Along that same thread, and let's talk about workforce metrics. In behavioral health, where burnout and turnover, we know, has been post-COVID has been amplified, maybe 100%, 50%, whatever that metric would be. Those are real concerns. And what are some of the most underutilized but powerful HR metrics that you would key off of or look at to understand how your organization is doing and how to make meaningful changes to recalibrate?
Yeah, every time you guys put out the survey, the ContinuumCloud annual survey, it's turnover, engagement, recruitment are always top five. And it has been in our industry forever. So what do we have to offer? Well, we need to still figure out how to make the best of it and how to make our work environment engaging, right? And one of the things that drives people is mission. So if we attract people to mission, then how do you measure whether we're successful in recruiting? So my favorite, time to fill. How long does it take to fill an open position? Because if I have a vacancy if they just hang there, that may tell me something about how we are selling ourselves as a place to do things, right? Because what our staff value is the work they're able to do, the good they're able to do. That, if you look at Gallup poll data from behavioral health organizations, one of the highest scoring things is the pride they feel in the work they do. So we have to be able to measure how well we're recruiting. So time to fill, turnover, both voluntary and involuntary. If you're losing people in the first 90 days, there's something that you need to attend to in your onboarding process or in who you are recruiting, because you're not recruiting people who are a fit. The vacancy rate, how many of our positions or percent are vacant at any time. Exit interview data. First of all, are you doing exit interviews? Yeah, good practice. And then secondly, why do people tell you they're leaving? And it's often a better opportunity because they don't want to burn bridges. But if you can really make them the case for these exit interviewers not going anywhere other than HR, or that you can guarantee that it's not somebody who's going to somehow give you a bad reference as a result, then it's really important to get that exit interview data. Are we recruiting a pool of applicants, or do we only have one or two applicants for each position? Which could give us, all of these offer insights into the process of recruiting and retaining. And there's the net promoter, net responder. Are we a preferred or net detractor? Are we a preferred employer in the community? So any ways that you can collect information about those things, those are all process measures for HR. That said, like I said, people are the thing that drives the ship. So I would argue that just about all of our impact measures are also HR measures. Because if we're having a good impact, that's also evidence that we're hiring the right people. And it's really nice to be able to share with that staff as an engagement tool. Hey, look at the impact you are having. When you see this many people, I know it's hard. I know you're seeing, 5 people a day, and you're picking up all of that stuff that comes with it as a counselor or clinician. But look at all the good we're doing by impact. So I think impact data is HR data in the sense of it's a good recruiting tool and it's a good engagement tool. And then it's also efficiency data, is all about the people we're hiring, right? So productivity, which is part of what we want to talk about next, I think. Productivity is a measure both of efficiency. And I, by the way, hate the term productivity because we don't manufacture service volume. The volume of services you're providing.
So how do you balance the volume of services you provide versus the, employee well-being part of the business as well? And, it might differ in business, but I got to be honest. I mean, we even say, it's good strategy and good people, and you're going to, your chances go way up on being successful. Yeah. It sounds even greater in behavioral health. So how do you strike that balance?
So yeah, my goal for my staff when I was a program manager and program director, I wanted my team to leave at 5 o'clock at night. and go home and be with their kids or their family or their dog or whatever they wanted to be doing. Maybe go paint. And so what I worked really hard was helping staff both understand the needs of how do we cover your salary, and as we want to create the opportunity to raise those salaries, what does the organization need to be able to generate in revenue, and how do we translate that revenue into what we expect you to do on a daily basis? And I'm a math wonk. My undergraduate degree's in math, so I would sit there and say to them, look, you have this productivity expectation of almost 1,200 hours if you're a clinician per year. We have this many holidays. So I would literally subtract out the hours for holidays, paid time off, and then say, okay, that means you're going to be working, if you want to only work 46 weeks out of the year, then here is how many people a day you ought to be seeing. And it would help them make that connection and say, I have some control over my time. And then the other thing is we can teach people how to, especially now with electronic records, but I even did it when I was a clinician, and I did do clinical work all while I was also a program manager. And by the end of every visit, I already had my documentation done. And there are really good, sound, clinically relevant ways to do that. It's called collaborative documentation. And you teach that. So you have to give people tools. They don't teach that in graduate school. So you have to give people tools to understand how they can manage their time to meet their goals as well as the organizations. And I really think that that's critical. And then I also think it's on the organization to design workflows, which we can now do with EHRs, that meet the needs of the client and the clinician and not the computer.
Very wise. I use those same phrases and examples with our staff as well. Software is a means to an end. It is a tool to help you achieve a goal.
Well, one of my implementation mantras is this is not an IT project, because IT is going to do what's easiest for the computer. That's what they're trained on, right? Yeah. You need clinicians to design workflows that work for the clinicians.
There you go. Even the models in AI are driven by examples and information that we feed it. For now, I do.
For now. Yeah. They only learn what we already know.
True indeed. Hey, so from a practical standpoint, what are some examples of real-time metrics that help managers course correct before a problem escalates or gets out of control, or it's unrecoverable? You've lost time or efficiencies or services.
So, so productivity is a good one to start with. And it's a place where a lot of people start, right? Simply because it's the best predictor of revenue. Yeah. If you don't produce services, you're not going to get paid for anything. So, but it's also a good metric for looking at demand for services. Do we have too few or too many staff? It's a metric that can also tell you how well you're meeting demand. So real-time data is essential for staff. So one of the really nice things that we started very quickly with productivity is we started measuring it, but we started sharing it directly with the employees that were being held accountable for it. So that every Monday, the staff person would get a report on their desktop, pop right up, that would tell them, this is how many hours you have worked year to date, been paid for. This is how many hours of productivity against what you're supposed to produce you're at. And that little line would be either green, yellow, or red. And give them a number. And it was real time every Monday. And at first, everybody wants to say, oh, that's not my real productivity. Here's my calendar. And we'd say, yes, but the calendar didn't show up. And once the numbers got trusted, I'll tell you what, by 10 o'clock Monday morning, if that report was not showing up, they were calling the data folks and saying, where's my report? Where's my report? Helped them plan their leave time, helped them figure out where they were in terms of their eligibility for bonus, because we tied that eventually. So it was really it was really an important measure for them to manage their own schedule and time. For managers, they could see where they had problem people. We would also add in a weighted factor if you were onboarding or leaving, so that we had a way of figuring out, if you're onboarding, you're picking up cases, you're still in a whole lot of orientation and onboarding kinds of classes. You had 2 or 3 months worth of, your standard was lower than if you had already been there. So you can do all of those kinds of calculations in the background and provide that employee instant information about how they're doing. You can do that with bed days. You can do that with any kind, whatever the metric is for that program, you can come out and report out a report. Every morning before I left for the office, I could tell you how many people we had in every kind of bed, whether it was a detox bed, a crisis bed, whatever it was. And I could see which programs were behind, and I could do it on my iPhone. So the more that you can automate those kinds of reports, it helps people manage. Managers need to know whether they have somebody who's an outlier. Managers need to know how they're doing, because they're required to have a certain amount of service units, because that's their revenue projection. And then you've also got units of service that can be used for fiscal purposes. So units of service by type, rate, period, rate for that period, so that if I'm producing an intake, the rate is that. And then what's the year to date? So again, real time, and it's all coming out of that service volume data, right? It's all coming out of how many services, and it all depends on how you slice it and aggregate it, what it means and what it tells you. But I had every week, I could see where we were relative to, and my CIO, who was just as nerdy, if not more than I was, had a chart that gave us how many work days there were in each month. Mm-hmm. So we could tell where we were relative to those. But it all starts. Service volume is the key, because we're in a fee-for-service industry. And even if you're capitated, even if you're in one of those way out there, value-based contracts, in capitation, you still know at the end of the month, you're going to have met your minimum service volume. You have to hit that 85%, which is usually the risk corridor for when you're no longer going to earn your full capitation. So it's critical, and it always starts with service volume.
Excellent. I do have one question that is probably a little obtuse, but did you gamify at all? Did anybody see anybody else's results, or were they very much personal and you drove the organization that way?
Oh, no. We had that. Well, you can't publish my productivity. That's my data. I'm like, actually not. No, it was published. Yeah. And who we first published it was our physicians. Competitive lot those guys are. And so you can do bonuses either at the end of the year with our physicians. We did them quarterly. Right. And so they all wanted to know everybody else's service volume, because they knew then. Yeah, we just to put it up. It was in our intranet.
I love it. I've seen that done in the past, and I was just curious whether that was effective.
Yeah. There's a lot. People have different organizations have different cultures, right? And culture shift, as we all know, is one of the hardest things to manage. And so none of this happens overnight. It took us years to get a robust information system that everyone was bought into.
I love it. So leading question there. How can organizations better connect process metrics like wait time, service documentation, stat scores, individuals? So we really talked about that to some degree, but if you were trying to culminate that all into how do you bring that all together to not just their services they offer, but as an organization? I was just curious how you did that, and what input your employees.
Well, we started small.
Yeah.
Right. So set targets. Collect some benchmark data. Where some baseline data. Where are we starting from?
Yep.
There's an old quality improvement saw: what you measure gets better, what you stop looking at gets worse almost immediately.
I almost quoted that earlier. I was going to say, if you don't If you take the time to measure, it matters. Metrics.
Exactly. Well, isn't that all true for everything, right? If you don't measure it, it means you're saying, and then if you never tell me that you looked at the measure,
That's right.
it doesn't matter either. And so we started out with just productivity as a measure, and then you start reporting on that. You work through all of the quality of the data, all of the that goes along with it. And you start then publishing, and you start tying it to people's performance. And then what is important to the organization, right? What is it that is important at a high level and at a low level? So from productivity, you start adding on things like, well, not every service that you provide is billable.
Yeah.
So how do we account for those things that are not billable? And some of it is because the activity itself is non-compensable under most payers. And some of it is clinician error. So you start by saying, when we say we set a productivity standard, it's only for those things that are compensable, right? But we subtract from that things that we are not able to bill through error. If you didn't have a treatment plan attached to that service and we can't bill for it, years in, we started subtracting that out. If your documentation is late, it's not concurrent. And we defined concurrent as 2 days at that. I don't know if that's still where they're defining it. And the reason it was 2 days is we had people who were in schools and places where they couldn't tie into the EHR because of the rules in that particular site. They wouldn't give us internet access. So we gave them time to get back to the office so they could get to their laptop, or where they could get to a laptop and internet and enter the data. So we had so if it wasn't concurrent, what I would say is, like, if somebody gave you a check and you failed to turn it in, if you're holding documentation, you're holding their check.
Yeah.
And so we started to add those kinds of metrics. We started to add client satisfaction data to the clinician dashboard. So you had all of these measures, and then at the end of the day, those translated into their job description, their job performance evaluations. So you start to say, why are these things important? Well, like I said, if you don't have documentation and I can't bill for the service, then your time got wasted from my perspective as a financial person, right? And so, but again, transparency, communicating to everybody why what we're measuring makes sense. If you can't get people in the door because you're having so many no-shows and your schedule is all clogged up, so all of these measures are, and you can't do them all at once. I always used to joke that if you get a set of good answers, high quality answers to a set of high quality questions, you'll have more questions. So it's iterative. You're always refining the question and drilling down into that. But you can't hold people accountable for things that you're not measuring. And you can't help improve things if you're not measuring. And so, again, it all comes back to, and there's no right or wrong answer, what is important to my organization at this time, given the situations that we're in and the resources that we have.
Man, I love this. This is really helpful and insightful. It also talks about how this industry differs from other being a services industry. I want to shift gears totally and through curveball. The integration of the CFO. So one thing I've seen in this industry compared to others, and I, just being the 1 year newbie, a lot of healthcare, but none behavioral health. The CFO is more important than ever. And how do you take that as productivity versus financial? And how do you make them a part of the process where it's not, to me, a typical CFO where it's at the end of the quarter, end of the month kind of metrics? It looks like that's a more interactive, helping drive prioritization. Can you kind of carry us a little further on that? How do you do that? And how does the CEO work with the CFO and the rest of the organization to make sure that you're making the right decisions with that data?
Yeah. So the challenge has always been, and it's true in any business, right? By the time the financial statement comes out and gets reviewed, that ship sailed. And there's right. And when you're looking at summary data, the problem with summary data is it doesn't tell you what is driving the ship. It doesn't tell you anything other than, okay, we had this much revenue and we expected that much revenue. But it doesn't give you any of the whys. So if you want the whys, you've got to look at what builds into that data. And one of the things that I like about a real-time system that's driven by the volume piece is that it lets you drill down into those metrics, right? And see what your payer mix was. Lets you see what your compliance was, your show rate. So I could look at data that showed me, I had a spreadsheet that said all the services that had been provided and the revenues to be expected over that month and how much had been collected. And we could actually see at 90 days, at 30 days, at 90 days, at 120 days, and then what I call the forget about it days had been paid, right? Down, and then I could drill into that by procedure code, by payer, by client if I wanted to. And so it allows the finance people a degree of granularity that, no matter what financial software you have, it's just going to import lump data from your GL into the reporting system. And so it doesn't give you granularity. So what's important, and frankly, the more successful CFOs are able to go between, what we had was a data warehouse that pulled GL, client, demographic, and staff data into one warehouse that we could then link up. So then the CFO can see at a very granular level, what is our AR right now? How aged is it? And by what? All the way down to a single client or by staff person. So I'm not very insistent on my client paying. I could see that.
Yeah. And that's mission critical. That was super insightful. So it sounds to me like if I were the takeaway for the audience, and I want to try to do a summary, and then you're just going to totally correct it. But it sounds like
okay.
Start with goals and key metrics and just iterate. And you've got to have that real time where you.
Yeah, it was a joke around our place that if I asked the same question 3 times, somebody in IT needed to start figuring out how to pull the data.
I love it. All right. We'll steal some of these. So if you were giving advice to our audience and how to successfully run one of these clinics or agencies like you've done in the past and you're out there consulting now, what's the key takeaway you would give them?
Start with what is critical to understanding how you support your programs and mission. Do not start with the whole universe of possible questions. Ask yourself right now, what is most critical? What's keeping me up at night? What do I worry about? And start collecting that information. It's going to build, but it has to build in a way that is well communicated, transparent to everybody, that has consistent levels of aggregation. Because oftentimes if you pull what you think is the same data, it's not. You pull it from 2 different sources and it's just slightly off. And now people go, aha, see, that's not right. So you have to be very clear. I've seen a lot of benchmarking that fails because the data definitions were inconsistent and people didn't realize that they were not comparing apples to apples and oranges to oranges because the data definitions were off. As much as possible, staff need to own the data, which means they need to understand what's leading to it and how they're responsible for creating it, fixing it, bragging about it. But start small. Don't think that you're going to, and I think that I worry sometimes when people just do these huge data warehouse projects without, now all you've got is all this data. Please start with a question. That's kind of please start with a question and start with a mission critical or infrastructure critical question.
Super, super helpful. And I heard a theme of words coming through: transparency, consistency, and iteration, and keeping it simple. And that I've heard throughout this discussion. So thank you for those. I think personally that, I resonate with that. And it sounds like that's even more critical in what we're serving as suppliers or partners. Maggie, thank you so much. It was an absolute honor and a pleasure to work with you. And we want to bring you back to another one in the future. For those listening, whether you're in HR, operations, finance, C-suite, wherever you're at, hopefully this conversation gave you ways to think about your metrics and how to enhance your organization and make it more sustainable. If you want more insights from Maggie, check out her past articles on or her blogs on ContinuumCloud.com. You'll find them out there. I'm sure you can also go to her site as well. And thanks again for tuning into the CloudCare Podcast. Be sure to subscribe and share this episode with a colleague who cares about operational excellence and organizational sustainability. For those that are interested, when you're out there on ContinuumCloud.com, we have our own behavioral health human capital management system as well. It's called Datus. And until next time, take care, stay safe, and operate more sustainably and more proficiently. So thanks to Maggie for joining. So thank you very much.
You're welcome. This is great.
Thanks so much for tuning in to this episode of the CloudCare Podcast. We hope you found value in this episode. If you're enjoying the show, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. That helps others find the show, and we greatly appreciate it. For more information on ContinuumCloud, the only platform built for behavioral health, feel free to visit our website, ContinuumCloud.com. Once again, thanks for listening, and we hope you'll join us soon in the next episode of the CloudCare Podcast.